The term resilience, as defined by Ian Deterdt, implies the ability to avoid, overcome, or adapt to adverse circumstances. A resilient individual adapts well in the face of trauma, tragedy, or significant stress. Today we are looking into a second-year paramedic student's cardiac arrest experience, breaking down the 5-part resilience model. The environment, thoughts, feelings, behaviors, and physical reactions in order to understand the individual's psychological resilience.
In late 2019, a second-year paramedicine student on a rural placement attended their first cardiac arrest. The incident occurred immediately upon starting night shift, but the preceding days had been presenting slow acuity call-outs. Thus, the student was both eager and apprehensive at the prospect of the big job after several quiet days. The crew arrived at a very dynamic scene in a rural setting with a number of first responders already working on the patient. The weather was quickly turning bad and an agitated horse threatened to disrupt the scene and pose a serious hazard. The student was instructed to handle the horse as they had some prior experience from their upbringing. But after securing the horse, the student is called to the scene, where multiple crews and firefighters are attempting to resuscitate the patient. The scene is cramped and chaotic. Conflicting instructions are barked at the student and he struggles to find his place amidst all the activity. They pitch in as best they can, but after half an hour of high-performance CPR and micro-interventions, they cease their efforts. This is the first patient the student has lost. The debrief amongst the various professionals make no particular effort to include the student, and they struggle to ascertain what an appropriate response in this context is. Nonetheless, the shift continues and the student throws themselves into their work before returning to their hotel room. He proceeds to drink a beer and contact a family to debrief. They also contact a CI they know socially to discuss
the cognitive aspect
afterwards.
of the resilience model refers to how we think or interpret a situation. According to Catalbiano, the core element of this model is that individual cognitions affect emotions, physical reactions, and in turn behavior. While stresses produce physiological changes, psychological factors play a crucial role in determining the meaning of the stressor and the manner in which the individual responds. In the subject's involvement in the cardiac arrest case, the cognitive process within the stressful encounter affected their performance and comprehension of the event. The subject's internal monologue consisted of persistent negative thoughts of being inexperienced and unskilled in the presence of so many confident professionals. These negative thoughts by the subject cause feelings of uselessness and role ambiguity, which occurs when the information about a person's function or task is unclear or confusing. The subject's lack of clinical experience, along with the negative thoughts, caused chaos and further physiological changes when assigned the role of temperature taking and taking over compressions shortly after. Anxious people often have what is referred to as cognitive distortion or unhelpful thinking styles. When inserting the test questions into the resilience model for cognition with relevance to our subject, it reveals that the reaction through these thoughts are normal, however unhelpful, and hinders performance. Therefore, we readjust to manage the reaction. This would have been useful for the subject to develop more helpful thoughts to reach an optimal reaction outcome. For example, instead of using negative connotations, the subject could have adjusted the thought of "I'm inexperienced and of no use" to "I can do small jobs such as temperature" to free up the hands of the more experienced paramedics, thus creating a more helpful and realistic idea and providing a sense of validation. In retrospect of the case, the subject's thoughts and emotions were expressed and discussed with their wife and a well-known clinical instructor as a coping mechanism after the stressful event. It was concluded that avoidance coping was significantly associated with an increase in PTSD symptoms following a 6-month prospective follow-up period in a 2002 study, and therefore the subject discussing these thoughts and feelings were notably of benefit. In addition, the subject could have further reached out by contacting peer support via the university team.
The emotion component of resilience refers to an individual's feelings or emotional experiences. When exposed to a traumatic event, an individual may be confronted with unhelpful thinking and thoughts, which can generate powerful and negative emotions. Paramedics are exposed to various traumatic events. As emergency workers, they must learn and adapt to keep their emotions under control. The ability to understand and act on these feelings through emotional intelligence aids in the development of emotional coping strategies and management. So emotional intelligence allows an individual to be aware, understand, and control their own feelings, and use this to enhance success and success of others. Catherine Fieldstad, 2010, suggested the emotional management benefit individuals by aiding them in coping with stressful situations and avoiding negative contagion through the promotion of emotional balance. So the subject's exposure to the event presented him with a new emotional challenge, questioning his emotional management and resilience. The student expressed that his lack of experience and knowledge of a traumatic event was a hindrance and a cause of negative thoughts and feelings. The student was left with a distinct impression that he was to manage his thoughts and emotions alone. When debriefing, comments were made such as, "Unfortunately, it is a part of the job," which suggests that the paramedics were making the use of emotional numbing as a coping mechanism. Chesney D. 2019 indicates the correlation between lack of social support and emotional expression leads to the development of disorders such as PTSD and depression. So when applying the resilience model test questions in the relation to the subject's emotions, it is believed that his reactions and emotions were normal for someone in this situation, although the lack of emotional management and occasional negative thoughts proved to be unhelpful, specifically when aiding in coping and emotional management.
When we talk about behaviours, we're making reference to actions an individual takes after a traumatic event, also known as coping mechanisms. A 2015 study into stress management in the workplace found that there were two main coping mechanisms that their participants displayed, and these were emotion-focused coping, which entails concentrated efforts to reduce negative emotional responses associated with stress, such as fear, embarrassment, anxiety, depression, and frustration. Emotional-focused coping does not directly address the root cause of the stress, but instead helps reduce these responses. As a result, emotion-focused coping is not an ideal long-term solution, as the stressor will still remain. Some of the coping techniques that come under this banner include distraction, emotional disclosure or venting, meditation, mindfulness, physical activity, drinking alcohol, focusing on future events. The second is problem-focused coping, which involves targeting the cause of stress in practical ways, which in turn will help alleviate the problem. Some techniques used under this banner include active problem solving, reflection and feedback, time management, obtaining instrumental social support. In relation to our case study, we can clearly see that our subject displays several emotion-focused coping strategies. They actively seek out avenues to communicate with a spouse. They engage in thought-provoking behaviors and actions, such as focusing on the next job. Furthermore, our subject also engages in mindfulness and physical activity by going for a walk to clear their head. Lastly, our subject also indulges in a beer. Despite problem-focused coping being the gold standard, it is not applicable in every situation. For example, dealing with the death of a loved one. The problem-focused coping strategy is not helpful, as the stressor is beyond the individual's control. In relation to our subject, we can see them actively try and obtain instrumental social support from a clinical instructor, as well as seek feedback from others to assess their own actions and try and change the outcome for their next patient.
Physical resilience refers to the human's body ability to react to certain stresses that interrupt homeostasis. In relation to the resilience model, biological response such as increased heart rate and blood pressure, an immediate release of energy, and amplified apprehension coincide are typical when presented with a stressful event. These reactions occur when the sympathetic nervous system is stimulated by a stressor. The adrenal medulla secretes adrenaline, activating the primal response commonly referred to as the fight or flight response. So the student's reaction to the traumatic event can be linked to general adaptation syndrome, beginning with the alarm reaction stage. This involves cortisol and adrenaline secretion. The student felt immediate rise in heart rate and perspiration as a result. In order to adapt to a new high-stress environment, the body lowers its cortisol levels to return back to its homeostatic state. This is called the resistance stage. The student entered this stage displaying signs of irritability and frustration towards themselves, resulting in negative thought process. The cognitive response can create more stress, initiating the first stage again. The student also described soreness in the joints once adrenaline had subsided, as CPR can be physically demanding. Research shows that paramedics experience musculoskeletal problems more than the general public, as well as high blood pressure and other physical health conditions. This is because of the increased physiological arousal whilst working jobs and the overall nature of the job. Although exercise is positive in reducing physiological reactions, a 2019 study finds that the nature of ambulance shift work comes with restrictions and commitment for routine exercise.
3 levels of environmental support must be considered when managing resilience: family support, community support, and social support. Social support is crucial for sustaining both physical and psychological health. Having strong social support networks can improve resilience to stress, ultimately reducing consequences of trauma-induced disorders, including PTSD. Family members are able to supply direct support and are found to be a trusted source for debriefing. This was seen in our study, as the subject confided in his wife as a sense of comfort. There was a lack of community support in this instance by Ambience Victoria, as the student was not contacted by peer support nor followed up with by clinical instructors after this event. To conclude, ultimately the student showed evidence of some positive strategies, yet when measured against the resilience model, he will have to learn to use the full breadth of the strategies available to him over the course of his career to avoid negative outcomes and redirect negative behaviors.